There are two main ways we can divert or reroute your urine after the bladder is removed: through a conduit or a neobladder. Both options use a piece of bowel from the part of the small intestine called the ileum. The ureters, or tubes that drain urine from your kidneys down to the bladder, are disconnected at the level of the bladder and connected to the urinary diversion. In an ileal conduit, the bowel segment, approximately 10 to 15 centimeters, is brought up to the skin of your abdomen to create a stoma, or mouth-like opening, which then drains urine continuously into a special ostomy appliance bag that is secured to your skin. It is the most common type of diversion and requires less operating room time than the neobladder. The ostomy appliance does need to be changed approximately every 5 to 7 days, and initially some patients can have some accidents with leakage of urine while trying to perfect the appliance. A neobladder requires a longer piece of bowel, about 45 to 60 centimeters, to make a new bladder, which is connected to the urethra just like your original bladder. It is all internal. Operating time is a little longer, and patients will need to go home with a catheter, a tube in the bladder to drain urine and let the bladder heal. You will have another tube which drains from your abdomen. When the catheters are removed in a couple of weeks, you will leak urine and have to wear a diaper or briefs until you can regain control of the muscles to hold your urine. Leakage of urine at night is common. Also, you will need to learn how to catheterize your bladder daily, as the piece of intestine naturally makes mucus which can build up and clog the urethra or form stones. The mucus can also lead to urinary infections by letting bacteria grow in the bladder. If you have poor liver function, a history of urethral strictures or cancer of the urethra, poor use of your hands, or poor kidney function, then a neobladder is not an option for you. Overall, the risk of complication is higher with a neobladder than an ileal conduit.